These recommendations included this list of circumstances where a video fluoroscopy should be considered. These include observations from previous screening tests or clinical non-instrumental swallowing assessments that suggest possible penetration aspiration or residue, and also situations where unconfirmed or unmanaged dysphagia represents a significant risk to the patient's health, and where dysphagia is suspected to be contributing to deterioration in the patient's medical status. Video fluoroscopy is also recommended to establish baseline swallowing function and guide prognosis in cases where disease progression or treatment side effects may lead to deterioration in swallowing, and in cases where anatomical changes are suspected and their impact on swallowing needs to be understood. And finally, the exam is recommended in cases where it is likely to influence patient management decisions.